Okay, team, we are going to treatment plan a lower overdenture in Romexis today. So I've opened the patient's Romexis file from a 10 by 10 scan that's 10 centimeters by 10 centimeters. You can see here about what that includes on the lower right. Okay, so I'm going to go to this slider bar right in the middle. I'm going to slide that until the blue line on the right side gets down right just above the mental foramen. So there's a mental foramen here and here. And then we're going to get the panoramic curve, which in line with the arch. So on the right side here, you see edit panoramic curve. We're going to select that. If you select the line, you can drag the whole line. We're going to put in this position, and then you can grab the individual dots and move it out from there. And you can see on the right side as we do this, the arch comes into focus. We'll drag this one over. So the next thing I'm going to do, we've already decided on the treatment plan for this patient that we are going to be placing 3 implants. So you'll see I'm centering, I'm putting the center line, the red line here, right on top of the foramen. In this view on the lower here, you can see the mental foramen. We're going to come over to draw nerve. We're going to select where the nerve would come out of the foramen. Then I usually will slide it like this to get a picture in my mind of, you can see, if you look right here, when we slide back and forth, you can see the canal. So what I'll do is bring the front line, the red line here, onto the foramen, and then I'll just go slice by slice here, marking the nerve. And you can look up top here and see, see that we're pretty much on the right path. Let's see. And anytime it's not really clear, you can just take and like scroll. Let's see, like here. I think it's here, but it could be there. I guess I'm going to select right here, and then we're going to slide it and see. Looks like we're following it, following it well there. And that's as far back as I'm going to go, because I'm not going to place an implant that far posterior. Really, I'm not even going to place an implant beyond the mental foramen at this point. So really, even just marking the first few centimeters is totally fine. So I'm going to deselect draw nerve, select it again. We're going to mark the foramen. I'm going to slide it back and forth, get a picture of where the nerve is, and then we're going to select the nerve. And let's see, and then if we want to move it, so we can go to the edit button here. All right, let's see. Deselect draw nerve. Let's see. That's right. Select edit curve, and then you can grab. Yep, you can grab the dots here. Oop. Not sure what happened there. Drag that up here. Okay. So there we go. All right. So now we're going to slide this over. So basically when we do 3 implants, I like to put one right in at the midline. And so you really want to, or what I like to do is get down in the basal bone. So you've got this thin bone here. You can see I'm going to say we're going to go to our implant library and get Zimmer tapered screw vent. I'm just going to try a 3.7 by 11.5. I'm going to set that as the default and add it to the plan. So we're going to bring that over. We could go a little bit longer, but I think this is going to be just fine. So you can see there, we're going to take away a decent amount of height, and we could potentially bring it up maybe here, but any more than that, what I've found is you end up with bone loss on the buckle here. So I really would rather do a little more bone reduction and then have a substantial amount of buckle bone rather than have those exposed threads anterior, on the facial of the implant. All right, so let's see. Usually what I'll do here is then, let's see, I've got those defaults marked. So I'll just come here, put one there, one here. Okay. All right. And then we can do these straight. I typically like to angle them. And I really will set these up similar as if I was going to do an all on X procedure. So if this patient decided, I really would like to have fixed, it's really just a matter of probably adding an implant here and here. Sometimes I'll go ahead and do 4, then it would be super easy to convert. But we try to balance the cost of these to make them as reasonable as we can. So 3 implants and then only 3 connections on the bar, and I found that that's plenty solid. So I go with that. All right. So let's see. So this one, all in all, pretty good. Again, I like to get it away from that buckle. I'd rather have it more toward the lingual. You tend to get more bone loss, or more easily get bone loss on the buckle. So I'll bring it in, and then we're going to go over to the patient's left. Same thing here. We're going to bring that in. Okay, so plenty of bone, down below the implant. You can see on this one, basically the bone reduction will be right to the apex of that root of the lower left. Looks like that might be a premolar back there. Okay, so we'll maximize here. We'll take a look. Okay, I like that pretty well. We'll mark the mesial of that foramen during the surgery. This one, yeah, also good. I mean, this is right on the mesial of your foramen here. It's in the surgery. We can decide if we want to bring that, adjust that location a little bit. Pardon it being a little bit jumpy. I'm remoted in from home. So there we go. That's pretty much it. And then from there, we'll go, what I like to do, we'll go left to right. Okay. And then I like to just measure the reduction at the area of the implants. So here from the peak of bone to the platform is 6 millimeters of reduction. We're going to bring that around to the midline. So there we go. Here from the peak of the bone coming straight down on the facial, which is where we would be marking it in surgery, is 7.2. And then we'll continue to bring that around. Let's see. Come back a little. Right there. And this one, pretty straightforward. It's just the base of that root, but let's see. Actually, I'm going to go just distal of that root, so we're not trying to measure off that broken down tooth. And then it's about 6.8. Okay. So from there, I will take a screenshot and draw out on the on my iPad the sizes of the implants that we plan to use, as well as the reduction that will be done at the time of surgery. So on surgery day, we'll remove these remaining teeth, remove the molars, reshape the mandible so that we have plenty of width for these implants. We'll place the 3 implants, place cover screws, and then this patient will have a transitional or temporary denture that he will wear for a few months until we do the second stage surgery, and then we fabricate his bar for his overdenture. Okay, so we have a screenshot here of the plan, and what I like to do with this is show the team, just for the team to have a visual of what the plan is going to be. So on the implants, I just write the sizes, diameter and length, and that can change in surgery, but it's good to let the team know what the plan is going to be so they can be prepared. And then also just to let them know, hey, I am aware of what's going on. I have a plan for today, and and that I've studied this case. So I'll mark what the bone reduction is going to be to give them some idea with that, and a reminder for myself. And then I'll mark, we've got 3 places here. Here we've got 6 millimeters of reduction. Right at the midline, we're going to have 7.2 millimeters. And then just distal to that broken off tooth is going to be 6.8 millimeters. So this will be pulled up on the screen at the time of surgery, or one of the monitors in the operatory, and it will allow the team to see exactly what the plan is going to be. That helps them with setup and helps them just know what's going on during the procedure.